Hello, thank you all so much for joining. I am Dr. Brittany Seymour. I'm an assistant professor and global health discipline director at Harvard School of Dental Medicine. I am also the project PI of what we are going to be talking about today toward competency-based best practices in teaching and learning, the Global Health Starter Kit. So before I introduce our speakers, I'm just going to explain a bit about what you're going to hear today. I'm going to provide some background information about how we developed the Global Health Starter Kit. And this is an online, open access, competency-based and classroom-ready curriculum that can be accessed for free and utilized. So you'll be hearing from Dr. Carlos Ferron. He's the executive director at the Inter-American Center for Global Health. And he has been using the Global Health Starter Kit to teach students a foundation in global health prior to field experiences. Preston Banub is a DMD candidate here at the Harvard School of Dental Medicine, and he will be talking about the other version of the kit, the learner version, which can be utilized either as self-guided, self-directed learning, or for teaching in a more of a flipped classroom style of teaching, and he will explain that further. I'm going to provide a timeline and the steps over approximately the last 7 years that we've taken to get us to the point today where we are able to share our Global Health Starter Kit. So we developed among the first formal global health courses within dental education in the United States. And this is published in the Journal of Dental Education if you want further reading, but this graph basically demonstrates that we piloted this early version of a global oral health course for about 13 students. And this graphic basically says that their perceived knowledge around the themes of the course, things like global trends and global disease patterns, and the integration of oral health and primary care, their perceived knowledge increased after the conclusion of the course as compared to previously. After that first pilot step, we then did a longitudinal evaluation of this course over the 5-year process, and we saw very similar results each year. And we also did a 5-year follow-up of all the course alumni who had enrolled in this elective course at HSDM, and they reported that their knowledge around these trends had been fairly well maintained over the years. They also reported that the content covered in the course had encouraged them to consider working with governments, non-governmental organizations, and other health professionals outside of dentistry, and even considering some career paths and career choices that they may not have considered before. So we were pleased with the outcomes of this course after the 5-year pilot. So around the same time we were evaluating our course here at the Harvard School of Dental Medicine, I was working very closely with the Global Oral Health Interest Group, which is one of the interest groups with CUGH, and I now direct this interest group. And in parallel to our pilot of our course here, GOHIG was developing a global oral health competency matrix. So we began to explore competency-based global health education within US dental schools. And that's what these two papers are about. These can also be found in the Journal of Dental Education. So what we did was we modified our course here at HSDM to align with the new global oral health competency as part of our core curriculum. So it's now a required course for our dental public health and general practice residents, and a required course in the core curriculum for all our second-year students. So the next steps, we decided to pilot the precursor to what is our Global Health Starter Kit. And we replaced all our previous course materials with these new competency-based course materials and tested to make sure that the students' reported knowledge was comparable to our prior courses compared to the new competency-based course materials. And again, these will be available in a forthcoming article in the Journal of Dental Education if you're interested in reading in more detail. But what these slides show is basically our Global Health Starter Kit materials, the pilot materials that we tested in the classroom before publishing them, they did just as well as our previous course materials. In many cases, they did better. So we felt fairly confident that after testing the course longitudinally within our own school, and then creating competency-based course materials that would become freely available for others to use, we felt confident that the materials were ready to be pilot tested at other institutions. So we held an application process, and through that application process, we selected 5 partner schools. Actually, it ended up being 6 now at this point, who expressed an interest in either launching or strengthening global health teaching and learning within their own curricula. And so through that application process, we selected schools, a variety of schools. Some were starting fresh, and others had a well-established program that they were looking to enhance. And this pilot process included site visits to each of these schools, where I met with the teaching team and the leadership who are interested in utilizing our materials to examine the feasibility of integrating a new curriculum that was created and tested somewhere else, and see how it's possible to integrate into their own programs. And so we now have a multitude of partners who are implementing on a pilot basis our materials in various ways within their own curricula. And we do plan on working closely with these, what we're calling our early adopters, to monitor their progress and how this is working for them. After these feasibility site visits, we then built the website where all of these materials are openly available and can be downloaded. These include videos as well that can be viewed directly on the website. And we sent the website with all the materials uploaded to the listserv for the Global Oral Health Interest Group, and asked them to explore the materials, see if they could download and access them, see if they could view the videos, and we received feedback from them. And each of these modules ended up being peer reviewed by at least 2, often more, of our GoHIG members. So we included that feedback. And in total, we sent this test link to our trial website to our membership of approximately 80 members. And we also utilized a team of 13 interdisciplinary and international authors to help in the writing of all the content for these materials. So as you can see, it was quite a robust process, and we really wanted to make sure that the content was strong and well supported by the literature and by expert consensus. We also wanted to make sure the content was accessible and could be integrated feasibly into other programs. And this is the final result. So this is the landing page for the Global Health Starter Kit. You can see at the bottom, hsdm.harvard.edu/Global Health Starter Kit is the URL if you want to click or copy paste and go to your own browsers. You can land on this page and access all of our materials. And as you'll see, we have 5 modules, and these modules are global trends, global goals, back to basics, primary care, social determinants and risks, and ethics and sustainability. This is an example. This is an example of, I just want to make sure my audio, I got a notice, hopefully my audio okay. This is an example if you click on Module 1, our Global Trends module, and you can see there are 2 versions of the materials, one geared toward instructors who will be teaching the content to their students, and the second is geared toward learners, as I mentioned, either to be utilized for self-guided learning or for learners to use these materials ahead of class time and then enter class and do more collaborative in-class activities. So the flipped classroom model. And so all 5 modules are laid out and formatted in this same manner. And so now it is my pleasure to turn it over to Dr. Ferrone, and he will be talking about the Global Health Starter Kit from the educator teacher perspective. Please feel free to reach out and email me with any questions. And please visit our Global Health Starter webpage and enter your email so you can get into a listserv and receive updates and more information.
Thanks, Brittany. So, hi everyone. I'll be covering what we've done here in Costa Rica, and I just want to send greetings to everyone here from San Jose, where I'm based. So, as Brittany was explaining, this starter kit lives on an online platform. What we've done here in the work in collaboration with Harvard School of Dental Medicine and the Inter-American Center for Global Health, we've tried to connect this online learning platform to a field-based or an experiential learning program, which we've called From Global to Local, a Focus on Oral Health. And I have a little diagram there of a double helix and someone climbing it, and I'll refer to that a little later in my presentation. Just to give you an overview of what we do here in Costa Rica during this program, one of the things that we do is that this program is actually it's run in a very intense 1 week manner. So we take the students, they land in San Jose, and then we immediately drive down around 7 hours to a bordering region in Costa Rica and Panama. So they stay there for a week, and it's a program that we've managed to design and implement together, both HSTM faculty with Dr. Brittany Seymour, which we just heard, and myself and others here at the Inter-American Center for Global Health. One of the unique components that we do is we combine HSTM students, which we'll hear from one later on, and UCR dental students. So we match them in order to have even a more comprehensive students. And part of what we do that is in order for them to have a better understanding on when we do comparative health systems. And as it is quite obvious at this point, what we do is we take the starter kit as a starting point. So we make all students take the starter kit before coming to Costa Rica, so we know that they're all going to be leveled in global health knowledge, but also our program here in Costa Rica, the experiential component, takes as a starting point the competencies that the students have developed during the starting kit, and then we try to reinforce and introduce new ones. I'm gonna apologize, as here one of the dogs which I live with is trying to get out, but I'm sorry for that. If you hear in the background. So let me see. Before I go forward, I want to talk a little bit about the institution that I represent, which is the Inter-American Center for Global Health. What we basically do is we try to serve as an interface between academic institutions and communities and programs and projects that represent very well the field of global health, and be in that ecosystem of these different stakeholders and scenarios and contexts. We try to build ethical and transformative global health education programs. So this program that we do with HSTM is only one of the programs that we do, but it's been one of the most successful ones because we managed to attach it to a longitudinal learning process in which we have an in-class Boston-based program, which is reinforced by the online global health starter kit, and then it's reinforced even more with our program in Costa Rica. So this is kind of the specialized work that we do here at CISG, and I'll provide a website address if someone's interested. They can learn a little bit more. Part of the success of our academic model, as I've mentioned, is what we focus on the ethical aspects of how to interact with communities and different actors when we're on the ground in these transformative learning experiential field-based courses. We do only participatory style learning, so that means the student is actively engaging in the discussion, building from prior knowledge, reaching new conclusions, and we based on a competency where our educational programs are based in competency. So the starter kit really is a good starting point because it's all competency driven education. So when we're all thinking about how to take this starter kit, and this is part of the let's say the nuggets of information that I want to transmit to you listening out there, is that when we're thinking of experiential learning opportunities like this one, like how to take a global health program which is linked to a starter kit which lives online, how do we link that to um, field-based learning? So what we try to consider here is where the student is in his career and his programming, what does he know, what are his capacities, but also what does he need to learn. So what is the framework of the ideal where we want to achieve? Then we take also the objectives of the home institution, in this case HSDM. What is it that the home institution wants the students to achieve? And then we consider also in a third realm, what are the things that on the ground, on the field-based programming that communities and institutional it can offer, but also what are their needs. So we try to combine and balance these three when we are doing these education programs. And then the next question that we have to do is how do we fit these competencies both into program learning objectives, then how these objectives would match activities, and then how are these objectives being met through assessments. So with the SHDM program, the Harvard School of Dental Medicine program, we created these matrices, and I'm not going to run you through all the details. I'm just going to show you very briefly what that process looks like. So first of all, we want to look at competencies versus learning outcomes. So to talk about competencies, I'm just going to take it a step back to what Dr. Seymour was mentioning around these competency matrix, uh, with the competency matrix for global oral health, which was one of the seminal papers that were released a couple of years ago that became a framework to follow when we were talking about global health in oral health professionals. So to the left, you'll see that these are the domains, and to the right, you'll see the more detailed competency matrix. So I just want you to focus a little bit on to the left, that the summarized one, and how it's broken up in three domains: knowledge, skills and abilities, and supporting competencies and principles. So what we do is we take this list of competencies and try to look at what already has been developed with the Global Health Starter Kit, which are additional competencies that we can develop on the ground, and which are competencies that we can reinforce on the ground. So we try to match those, and we create a specific program objectives or learning outcomes in which, again, these have to match the learning, the competency matrix that we are saying is the guiding matrix for both the Global Health Starter Kit and our program. So things such as during this program, after a week, the student should be able to, I'm just going to read some out loud, outline the health needs and inequities among communities in Southern Costa Rica. Why Southern Costa Rica? Because I mentioned that's where the context of the student, where the student develops the online platform. But at the same time, it's not only that they're learning about health needs and inequities in Southern Costa Rica, but they're also doing compare and contrast exercise on how does those inequities and those health outcomes and health needs match where their context come from. So I'll show you in a second what that looks like in competency language according to the Global Oral Health Competency Matrix. So we go over this and we match these to these competencies. So again, with this diagram, it looks small. I just want you to kind of picture how we're looking at these competencies, and we are tailoring some of these. We can't go cover all of them. It would be kind of too too much of a stretch to say that we're covering all of them, because first of all, there's some of these also that are clinical in nature, and we don't do clinical work with our students, but we do things around health systems. We cover things around equity. We cover things around understanding context, and that's what our program objectives of on the ground and the field-based course actually try to achieve. So to give you some examples, these are the competencies from the matrix. These are some of the ones that we consider we reinforce in a more effective manner. So things like identify and describe common risk factors of oral diseases. They do this, they go through over this in the Global Health Starter Kit. And then when we're on the ground, we reinforce that framework of thinking of what are these common risk factor approach. We also do things around identifying barriers to access and use of health. So in the course, we use a specific example of a man named Joe, and Preston will speak to that in a second. But Joe then has some barriers to achieving care. We don't hear from Joe in our field course component, but we go and we talk to communities and we ask them what are some of the barriers that you've experienced when accessing oral health care, and then we compare how does Joe compare to this other person in Costa Rica, and how are ways that we can think of creatively to resolve some of these barriers. So the overall idea here that I want to push is that although the content is not the same, the competency is the guiding framework of what our learning outcomes and the learning activities look like. So just to run you through very briefly what the content and the day-to-day looks like when we're here in Costa Rica. And we've basically divided these into themes, as we like to call them at CISG. We always introduce the global health components with an overarching theme of health systems. So you've got to understand what oral health means under the overall health system, both at a local level, at a regional level, at a country level, but also at an international level. So we use case studies with each theme that allow us to elaborate further in how these different topics, objectives, and competencies can be explored in a specific case. So to the right, you'll see what those case studies look like that we've developed here at CISG. So the first one looks at the ABICE system, which is our basic a primary healthcare network of clinics that exists here in Costa Rica, which is very unique to the world. And we look at that as what does oral healthcare looks through the lens of primary healthcare in order to understand how this fits into a global, regional, and national health system. We go over governance and we look at issues around migration. We look at system thinking as a basic understanding of context and how context can influence health outcomes, but also how we need to understand the diversity of actors. We focus on culture as a determinant of health because part of the work that we do at CASG is integrate intercultural approaches into the work that we do both at education level and implementation level and research level, because a lot of our stakeholders are from indigenous communities, both from Costa Rica and Panama. And then we go into more specific issues such as how is the nutritional transition, the epidemiological transition, and the demographic transition impacting oral health, so the student can start to understand some of these global trends or reinforce these global trends that we had covered during the oral the global health starter kits. And finally, the ethics of this whole engagement, which is one of the main modules, the last module, but one of the most important in the Global Health Starter Kit. We have that conversation once again at the end of our course after experiencing that week in Costa Rica and having been engaging a diversity of actors in Southern Costa Rica. So this is kind of just a flavor of what the students do when they're on the ground. But again, the overall idea here is that these are linked. There needs to be a clear linkage into how program objectives are being met through these activities and these content themes. Okay, so as you can see, what I'm going to do now, I'm going to try to link these three and try to iterate a way in which I know that these themes, activities, field-based learning is meeting the program objectives, which at the same time are meeting the competencies. So when I'm designing, I take competencies, programs, themes, and activities. But when I'm implementing, I actually want to go the other way around: themes, activities, program objectives, competencies. In this way, what we have is a kind of a circular process, which is then an iterative, reinforcing, a very redundant process of education in which we have the Global Health Starter Kit and this other component of field-based learning reinforcing each other. And that's where we came up with this concept of this global health learning helix, in which if we imagine a DNA strand with these two, with the two strands forming a helix and the middle connecting dots being the nucleotides of the DNA strand. If we imagine these two strands, those would be, one of the strands would be the experiential component. The other part of the strand would be the more class-based learning that can be either the Global Health Starter Kit or the class that actually Dr. Seymour developed in HSDM. So we try to reinforce the numbers that you see there that are connecting the two strands are the actual competencies. So the idea is that through these not necessarily simultaneous learning environments, we get to reinforce the different competencies. So the Global Learning Helix is about redundancy and iteration. This is something really important in education, which is not the same to say as repetition. Repetition is important, but more than repetition, we want to reach the same. We want to have students reach the same competencies through different ways, and that's what we do with this Global Health Learning Helix model. Now you'll be able to read a little bit more about this in the forthcoming article that we're publishing in the Journal for Dental Education. So it should be out soon. We'll make sure, if you're interested, we'll send you the link to that article. And how do we achieve this? At the end, how do we achieve these outcomes, these competencies for our students? Well, we have these multi-formatted experiential-based learning, which takes into consideration a collaborative learning environment, both on the online platform and on the ground. And we use a lot of participatory methodologies, everything from these key stakeholder interviews to field visits to in-class discussions, workshop, and the case study analysis. So with this, I'm just going to show you some pictures of what the actual on-the-ground component looks like. Here we have two community leaders, Nelly Gallardo and Dominga Palacios, discussing to the students and faculty and other visitors on how oral health is understood from this specific community's perspective. What are some of the barriers to access? What are some of the benefits of the work that the Social Security system has been doing with communities regarding oral health? So this is basically a very horizontal, very in situ conversations where students are understanding things around water, fluoridation, but also things around diet and other determinants of health. But the course also requires students to share among their prior knowledge. And here we have two students from University of Costa Rica discussing with a US-based student, basically, how does the determinants of health impact global oral health? So these are kind of what the scenarios look like. This is our day-to-day. We do half field the day, half in class day, and that's more or less the norm. And before I finalize, I just want to send you this picture of the actual participants of our first cohort of students. You'll see there that there is also some CISG faculty, some community members, the nurses from the primary healthcare clinic, and the doctor from the primary healthcare clinic. So with that, I'm going to pass it on to Preston. But if you want to have a little bit more information of the things that I mentioned, please do email me. That's cfiron@cisgcr.org, or visit our website where you can find a little bit more about our model, cisgcr.org. So thank you again for tuning in. I hope you have good questions at the end. So Preston, please take it away.
Thank you. Hi, my name's Preston. I am a third-year dental student at HSDM, and I'm going to talk a little bit about actually how the specifics of the course and how it worked for me. So first of all, I'm from Milwaukee, Wisconsin, and to be honest, before coming to school here and taking this course, I didn't actually know what global health was. I thought I knew what it was. I had my personal experiences where I had more of like outreach work in my local community and saw some of the needs here. And I kind of just assumed that global health was that just somewhere else across the globe. So yeah, I learned through this course that that's not what global health is, and there's so much more to that. And in my presentation, if you don't really take anything away from this, I just want you to know that this method of learning really works. It really works well, and it's very effective. So I guess I'm going to go specifically into my experience of flipped classroom learning and with this Global Health Starter Kit module, which we did throughout school. So traditional learning it works, but it's not the most effective style of learning. So judging by the time, this conference call has been going on for 30 minutes. There's probably some of our listeners out there which are maybe checking their emails or doing other things, just because humans' attention span is actually not as great as we'd like it to be. So the traditional standard of lecture learning, where we're sitting here listening to people talk, trying to take some notes, trying to pay attention, isn't exactly optimal for learning, and doesn't really leave a lot of space for asking very thought out questions. Oh, sorry, one second. Sorry about that. So yeah, it doesn't leave exactly much room for being able to ask thought out questions, because we're learning the material for probably, the first time, or have very limited experience with the material. What Flipped Classroom does is kind of change that. If it's prepared very well, there's going to be a list of streamlined learning materials for us to have a very strong working knowledge of the material we're going to look at. And then we take that working knowledge we build through our various reading materials and videos and lectures, which I'm going to go through in a bit, and then we actually apply it in the classroom. So in the classroom, we'll either have case-based learning, where we'll set up a case or talk through a patient, which we'll go through in here and see, how does the objectives we're learning actually apply. Moreover, this allows us to learn from our fellow students. So I may come in and have learned something from my reading, and another student may have a different view about it. So now I'm learning from my other students, I'm learning from the faculty there, and I'm learning by actually applying, which leads to more long-term retention learning. So specifically, I'll go through an example of what this course might look like. So if you go online to the Global Health Starter Kit, there's going to be options for the students. So the example we have here is Module 4, Social Determinants and Risk. So before we even start, we have something called a learner guide. So what I would do is I would open a document and look at this learner guide and say, okay, Module 4, what am I about to learn today? Right away, right off the bat. No ambiguity. It just says, please plan approximately 3 hours. So there's no ambiguity. It takes a lot of the stress out of learning. I know exactly what I'm going to have to do to be prepared to apply myself during class. So, and it specifically tells us what we want to learn and what objectives we want to get away when we're going through the material. So for example, there'll be pre-readings. So we'll do these readings, which gives us a strong working knowledge of what we're about to go through. Then there's going to be some extremely well-made pre-class videos. And these are essentially like traditional lectures, except they're very streamlined. They're very well produced. And they even include questions where you pause the video and you can answer these questions, which just create more hooks in your memory for what you're learning. This is just the learning competencies and saying what exactly are we learning by going through this module. And when we read through these, we should have a strong understanding of the various learning objectives once we finish all the preparatory work. Right. So this is an example of the video. We had this scenario with Joe, and it talked about, or brainstormed in the video, what exactly does Joe actually have to do to go to the dentist when Joe has a toothache? And we learned through the video that, and it would pause and have us brainstorm answers to all these questions, that there's much more than, Joe just going to the dentist. He has to first realize that, hey, I actually want to go seek dental care. He has to be able to get there, proper transportation, and there's many things like weather or inability to actually be transported that can go into that, or no clinic being nearby. Then he has to actually be able to get to the clinic, and once there, receive appropriate care. So it still kind of blows my mind how the idea of Joe sticks in my mind. And I don't think the idea of Joe really would have stuck in my mind if all I saw was the video. Let me go back to the first slide and just show, I think there's a good picture of an example of what we actually do in class. So after I did the readings and watched this video with Joe and saw that, you know, I have the learning objectives to my understanding, we would get to class and actually brainstorm. So we would get up on a whiteboard, get into groups, and, you know, actually make, you know, a diagram or make some sort of assignment as a class about, you know, maybe the social determinants of health or like the barriers that go into the specific case. And that really cemented Joe into my head. And moreover, we also had a case study another day about, you know, receiving care in Alaska. And then we had to apply these concepts we learned through our reading and, you know, the concepts we learned through the concept videos and then the concepts that we learned through our in-class activity to this other case study of, you know, maybe what are the barriers of care for patients in that population. So I was able to see these resources or see these concepts and learning objectives in multiple different lights, which really cemented the idea and filled in any gaps in my learning. Moreover, because once again, what really makes this method effective is the resources have to be extremely well done. And for our Global Health Starter Kit, they were really well done. Not only did we have videos, but we had notes specifically tailored to the videos, and we even had a transcript made. So whatever your learning style is, or wherever you are, you always had access to this wealth of information, which made, you know, self-guided learning and reviewing very, very accessible. So here's an example talking about, you know, what Joe needs to do to actually receive care, and he was talking about this first barrier, which is deciding to seek appropriate care, and then these other factors that could go into it, like finances or cultural beliefs. So yeah, this is showing just the different modules. So I walked you through module 4, which is the social determinants of risk, but what we just went through is available through all of these modules. So then after it's time to, you know, you finish the series of learning, you have a good understanding. I go back to the study guide, and there's going to be a series of learning objectives there and critical errors. Essentially, it'll tell you these are the core competencies, and it'll have specific statements saying like, it is a critical error if you do not know that, you know, X, Y, and Z, or you do not know this definition. And essentially, I could go back and look through all of our materials and make sure that, you know, I understand those. So altogether, using this, using the flipped classroom style gave me, you know, it wasn't short-term memorization. For me, it really was long-term learning. And this was for the first time in a long time that I actually learned almost seamlessly instead of just sat and memorized and forgot for a test. And this is something now I can think about with all of my patients, now that I'm seeing patients third year. Instead of just seeing a patient and thinking about the science or being like, oh, I know you have social determinants of health, I can actually cater this to each patient and be like, you know, this is my patient Joe. And, you know, when I take a social history, Joe lives here, and like, oh, what does it actually take for Joe to be able, you know, to come into my chair? And, you know, maybe what are Joe's cultural beliefs, which are, you know, making this dental care more difficult for him. So overall, the flipped classroom is an extremely effective way of actually learning in lieu of memorizing. And if the materials are done correctly, which they are in this Global Health Starter Kit, it's an extremely valuable resource. And that is all for me.
Thank you so much to you both. We now have time for some questions, if anybody has any. And I'm also happy to actually go to the Starter Kit website and give a little bit of a tour if people think that will be helpful. So let's see, I'm not seeing questions just yet. So why don't I take us, let's see if this will work. I'm going to go ahead and take us to the website, and then we can play around a little bit with the drop-down menus, and you can see the options. So here is the actual web page. And so you enter the URL that I had introduced earlier. It's the hsdm.harvard.edu/global-health-starter-kit. That's the website, and you will come to the landing page. And right here is an introductory video that you can play right on the website, and it's me, there's a lot of me, where I am introducing the kit, talking a little bit about the background, which you've heard, talking about for instructors who want to use it, the applicability, and give some ideas of how you may want to use the materials. Here's some background about the competencies and how we developed those. You can also see here a written transcript. So we've provided written transcripts of all of our videos to help for folks who have various learning styles. Some learn well visually, some need to read something after hearing it. So we've tried to really be thorough with our materials. This is what I had mentioned earlier, asking if you can click here to subscribe. We are trying to get to know people who are interested in this so that we can reach out with updates, news, new materials, webinars that we may be having again in the future, but as well as reaching out and asking you, how are the materials working for you? Are there ways that we can improve it? Is there something missing that you would like to see? So we're really working hard to make sure that this curriculum is meeting a variety of needs for a variety of users. So as you continue to scroll down the page, you can see that all 5 modules are listed here. You can learn about our wonderful expert team of authors and editors of our starter kit. There's a syllabus, so some educators are utilizing the kit as a ready-made class and course. So this syllabus can be downloaded and provided for students. And then multiple places with some frequently asked questions about the starter kit, which I will take us to in a minute. If you do utilize these materials, again, they are free and available for anyone, but we do ask that when appropriate to please cite the materials if possible. And then of course you can see our acknowledgement section that this really was an amazing team of funders and supporters who helped over the years, and especially last year, in getting the website and all of our materials ready. I'm going to take you to the FAQs, just because these might answer some common questions that people might be thinking about right now. So who can use the Global Health Starter Kit? And truly the answer is anyone. That sounds very broad, but that's our goal, that these materials can be used in pieces or as a whole. And it's not just geared toward people within the dental profession or for oral health folks. It really is, it was written by an interdisciplinary team of authors to be utilized by a multitude of groups and educators and learners who are interested in global health and who have an interest in understanding the connections between global health and oral health. So it really can serve a broad purpose far outside of just the dental profession and dental education. We do want to make sure that people know this is not a Harvard course. I explained that it was at one point a course that we developed and taught within the Harvard School of Dental Medicine, but now this is a freely available curriculum or starter kit of curriculum materials that others can use in their own courses. So CISG does not say we teach a Harvard course. CISG utilizes these materials and takes ownership over the course once it's finished, even though our materials provide a foundation for the CISG course. We have been asked a number of times that if people complete the course, can they get credit? Now, it's not an online course, and that's the difference. It's an online set of materials that can be used in a variety of ways, but it's not a Harvard course where we are teaching it and giving credit to people who take that. So that's different. And then another question we get is, can I modify and adapt the materials? And absolutely, that's one of our goals, is we really want people to use the materials to fit their specific needs. and for their target audiences. So again, if you are using our materials, we just ask for proper citation, but you do not need to use, if you have, for example, module 2 and you want to download the educator presentation, you do not need to teach the entire presentation in full. You can utilize bits and pieces of it to enhance your own materials if that's what works best for you. And that leads me to this next question. Are the modules meant to be taught in full and in order? They can be, and we do sometimes, if we're teaching module 4, we may go back and reference, you remember in module 1 when we covered, but they are also designed to be standalone modules. So some of our partners who are using materials don't teach all 5 modules. They may, for example, only teach module 5. So they are all meant to be complete in and of themselves, but they do link and streamline well if you want to teach them in full. Another common question we get is why everything is only available in PDF format and not PowerPoint, for example, and that is just the way the HSDM website currently works. So we can't actually support PowerPoint presentations right now, so we've created a PDF version of all our presentations, and that's how everything can be downloaded. But because that's a common question, we are working on seeing if we can change our platform a bit so that the PowerPoint versions can be available. I am happy to provide those if people email me requesting specific formats that are not available on the website. Another question is about our pre-readings. So we worked very hard to find high quality selective readings that support each module. And for the most part, we've identified open access readings, but some readings that we feel are really important to the modules are in journals that are behind a paywall or a subscription. And as we know in global health, that's a universal challenge that we are really working to disrupt so that all educational materials and articles are open access. But currently, in the meantime, some of our recommended readings are only available through journal subscriptions. And for copyright reasons, we cannot, through this project and through this website, provide those readings. But we're hopeful that our additional references and those that are open access will be adequate for people who are not able to access those. We have a contact us form. We monitor that fairly regularly so we can be responsive to questions and inquiries. And we welcome people sharing these materials. Once again, the goal is the spirit of the public good. We really want these materials to be used for everybody that can find them helpful. So as I mentioned, please sign up on the website to become a registered user. So why don't I take you back through one of the modules. So you've seen module 1 and 4 through our presentation. So let's go to the Back to Basics primary care module. And this one covers universal health coverage and a strong primary care system and where and how oral health fits in to the new global goal of universal health coverage. So when you click, you come to the module homepage and you can see instructor materials and you can see learner materials. When you click, you see the drop-down menu, the instructor guide, you can click on that, the instructor presentation, which is the PDF format, instructor notes. So these are detailed teaching notes that come available for each slide of the instructor presentation, because we have some faculty and educators who may not have the same background knowledge on all of our topics. So as you can see, for each slide, as you're giving the presentation, we have detailed teaching notes to provide you with some background information about the content contained in the presentations, as well as references for all the information presented. For the learner information, oh, one more thing I want to mention. If you click on the instructor video, you'll hear me talking about how I teach this module and how I incorporate some in-class activities and interactive exercises for my students. So I give some tips and techniques to teaching the content, as well as providing a brief introduction overall on what you will be covering in this module. The learner materials Preston went through in good detail. There's a preparation guide for learners There is the learner video. This is more detailed than the instructor video. The instructor video is basically an introduction for those who are about to teach the presentation. The learner video is, as Preston mentioned, essentially an online lecture. The advantage of having it in video format is students can pace themselves, and we have inserted questions and thought exercises where students can pause, reflect, look back on their readings. We also have detailed transcripts and notes that go along with the video so that students can use multiple learning resources to master this content. So essentially, there's the form where you can provide feedback and register. That's what the website looks like. So we really encourage communication, questions, and people to register as users so that you can explore the materials. Registration is not required. You don't have to register or provide any information if you want to access the materials, but it's really helpful for us to know who's using them and why, especially if we're looking for feedback to continue to grow and enhance the project. So now I will circle back and ask if anybody has any questions. Let's see. So there's a question about Joe and being individual social needs versus population and structural. And this is emphasizing that, let's see, social needs are necessary but not sufficient to address social determinants. How do you handle policy and advocacy? Great question, and that is module 2. So basically the modules, as I had mentioned, were designed to be taught in order. Module 1 basically introduces the challenge. Here's the problem. Talks about the global burden of disease, talks about the epidemiologic and demographic and nutrition transitions, and lays out the challenges that we're facing today in healthcare. Module 2 then focuses on systems level issues and challenges, the global health development agenda, the social or the global goals, and that takes a policy and advocacy approach. And then we go from there. Another question, how are we planning to expand this kit, especially to developing countries teaching global oral health? And thank you so much. We have several authors who are from countries outside of the US, including from the region where this individual question came from. And so our goal is to make this globally accessible. We have worked on allowing closed captioning in a number of different languages to try to expand who can use these. And we may be looking at publishing more materials in other languages as well. We've also tried to make the videos and the materials easy to access for those who might not have a lot of internet bandwidth or whose internet may not be as reliable, again, because this is web-based. And when we went through our trial process before launching the website live, that was some feedback we got from our partners who are in low and middle income countries and who didn't have as reliable of an internet connection, so that we were able to condense the materials and make them more easily accessible if internet wasn't as reliable. So that's just one example, but our goal is certainly to make these materials as available to people around the world as possible. I will add that those of you who are interested who might not be based here in the United States, that's another reason we would love you to sign up and register, because your feedback on ideas for how to continue to grow the materials and to make them as accessible as possible is extremely helpful for us. Another question is, what educational background is needed for those who plan to use the kit? We call this a starter curriculum because it's a baseline knowledge that we provide. It's an introduction, but that is something that we are actively working on with our partners. So as Preston mentioned, he came to dental school and didn't have much background at all in global health, and that's not common. Global health is not currently taught in dental school, and so if students chose to learn global health in their undergraduate education prior to dental school, they may have some background, but that is not a guarantee. So we wrote these materials so that people coming in with various levels, from no background to some or even more advanced, can still find something useful in the curriculum. I will also add that faculty development is something that we're learning through our partners that's very important and useful, that a lot of faculty may not have a strong background in global health. And that's why we have produced such detailed teaching notes and instructor teaching guides and videos to help faculty who may not be as familiar with this content to feel more prepared in order to teach it. I see that we have about 5 minutes left. Any other questions? Oh yes, thank you, wonderful. Are there recommended measures for the competencies addressed in the modules? I think this question might be referencing assessment and evaluation. And if that's the case, we do have some metrics for assessment, so guidance on how to evaluate students. And I'm not meaning multiple choice or essay exam, but what I mean is what knowledge or what skills do you want students to be able to demonstrate at the end of each module? And so this measure of assessment is in detail and included in the instructor guides. We also have some example multiple choice questions based on those measures of assessment, just to be used as examples, but I do know that some of our pilot users are using those multiple choice questions as their exam for the final after teaching these materials. Feedback we've received is that more assessments, actual assessments, would be very helpful for people rather than just the guides for creating assessments. That's something we're working on. Another question, will this material be maintained and updated going forth? That is our goal. As you explore, you'll see that it was very resource intensive. Our goal was to create a very robust, high quality learning experience and teaching experience, which meant studio time and a lot of faculty and student time to get to this point. So we are continuing to work on securing funding and protecting resources so that we can keep these materials up to date. Because I'm sure, as you know, global health changes quickly and rapidly. So that is our goal, is to try to maintain these and keep them up to date on a fairly regular basis. And somebody says, no question, but we are out here listening, and I appreciate that. And someone else says, thank you, this was great. I am really appreciative for those of you who joined us today. I want to thank my speakers, Carlos and Preston, for their contributions. And I really want to encourage people to contact each of us. Our emails will be available, and to please register on the website and send any questions and ideas our way. I'm going to ask Carlos and Preston if they have anything else they would like to add.
Just thank everyone that attended and stayed till the end. I appreciate that. Hope this was useful. Looking forward to connecting.
Yeah, thank you so much for attending and listening.
And thank you to you both once again. And again, I want to just express my gratitude for everybody who joined, and to please keep in touch, because we hope this is just the beginning. Have a wonderful rest of your afternoons, evenings, whatever time zone you might be in.